Good afternoon, ladies. This is State Representative Dave Rutigliano. I am very honored to be joined with Margaret Watt, the co-director of the Hub, a regional behavioral health organization for Southwestern Connecticut, and of course, our own Melissa McGarry, who runs TPAUD and has other accomplishments. So I just thought we could take a second, because we've been having conversations about the stress of homeschooling, the stress of distance learning, and the COVID on the family and the children. And we've been sort of taking questions from families and neighbors and asking professionals such as yourself, and hoping we get some answers or at least some resources so we can turn to. So if you could just take a minute, explain exactly what you do and your most impressive resumes, that would be a good thing.
Okay, I'll go first. Thanks, Dave. Thanks for having us. I'm Melissa McGarry. I'm the project director for TPAUD, which is Trumbull's Prevention Partnership. We are a grant-funded community coalition, so a group of concerned citizens and stakeholders and parents and kids who are dedicated to reducing youth drug and alcohol use, fostering social and emotional wellness, and building a safe and healthy community. So we do that through a lot of education and outreach and working with our community partners like Margaret and yourself to get information out to the community to help our kids.
I must say that I've been a proud member of TPAUD for a few years now, and I really like the mission. The mission is to educate me and other parents on signs, and symptoms of our kids abusing alcohol and drugs, really giving me tools to sort of recognize what's going on. So from my first exposure to TPAUD, I thought it was so smart, you know, instead of just going after the kids all the time, let's go after the people that are supposed to be watching the kids and give us the tools and tricks we need. So I really appreciate TPAUD. And
thank you.
I meant to say thanks, I guess.
Nice.
Margaret?
Hi, everybody. I'm Margaret Watt. I'm the co-director of the Hub, which is located in Norwalk, but we serve Greenwich to Stratford. We are one of the 5 regional behavioral health action organizations in the state of Connecticut. And our role is to be a liaison between the state and the region and then the towns, Trumbull being one of our 14, to sort of integrate and support and coordinate efforts around mental health, suicide, substance use, and problem gambling. And so I've enjoyed being a part of TPAUD as well as working on some of the other prevention coalitions in the region and, you know, trying to make a difference on the prevention side as well as treatment and recovery.
So before I get right into the questions, I want to say that I did go to the hubct.com, and I'm going to say that early in this.
.org.
Just .org.
.org, I'm sorry. The hubct.org. It was such a wealth of information. We were making jokes earlier that, geez, had I seen this ahead of time, I may not have had all the questions, because a lot of the answers are sitting right there. But in your opinion, one of the first questions was, what are the issues you see facing Trumbull families as they deal with the coronavirus and all the stress that's associated with it?
You know, we're all in the same storm, and I think probably the biggest issue is uncertainty around school, uncertainty around work, uncertainty around what our new reality is. So we're all dealing with that in some capacity, whether you're one of our senior citizens or whether you're one of our preschoolers. So I think we all need to learn how to navigate that piece of it and accept that a bit of anxiety and a bit of, you know, feeling really untethered is completely normal. So I think that we all need to kind of, you know, put a baseline on that. There are people who are dealing with some really concrete needs right now because of loss of jobs, and I think we've got some great resources in Trumbull that can help people who need help with food assistance. You know, the Trumbull Social Services has a wonderful food bank, which is being well supported by the community and is ready for anyone who needs help with those types of things, with groceries or fuel assistance or any of those pieces of kind of the nuts and bolts. And then senior services also helping trying to outreach to our senior citizens, even at a time when they can't come in physically. So they're still trying to offer things to our residents. We have a local counseling center, the Mary J. Sherlock Counseling Center, for people who need some emotional or mental health support. It's a great resource. They're doing telemedicine, so you don't even need to be, you don't need to be face-to-face. They bill on a sliding scale, so you don't need to have insurance, And they also have a licensed alcohol and drug counselor on site. So that's great for like in our town.
If I get this right, say thanks. Give me an opportunity to plug our social distancing food drive we do every Wednesday, 4 to 6 at the Trumbull Library. The people at Trumbull have been unbelievable. We filled an ambulance just about every week, and those awesome people delivered to the food bank the next day. So.
Awesome. Yeah, it's wonderful. In terms of, you know, other resources, I'm sure, Margaret, you can speak to what's more regional or statewide for people who just might need a little extra support at this time.
Yeah, you know, people are experiencing so much more anxiety than they have been in the past, as you said. And so there are particular populations that are really, really vulnerable are the teens and young adults who were already a struggling population this whole generation.
Dogs. This is awesome.
Edit.
Oh, that's awesome. I love that. I'm surprised my dog didn't react.
Yeah. I have a beagle, so my dog just sleeps. I mean, that's it. There's no, you know.
We should talk about the fact that the happiest creature in our households are the pets.
Oh,
right
by far, fat and happy. No question about it.
Yeah. My dog's getting 8 miles a day.
Yeah. I'm so glad Dave has people to edit. And the problem is it's raining, which I didn't realize. So they won't go out. So they could do it again, but they won't go out in the rain. Sorry.
Oops.
Don't be sorry. Honestly, like I said, I actually enjoy. Anyway, the chaos of life is one of the best things. Anyway,
it's
sure.
All right, let's take that question over. So edit, you know, reset. So wait, let's see. Yeah.
Vulnerable.
So
we were talking about resources, I think.
Yeah.
Okay.
Vulnerable.
Okay. So yeah, there are so many people who are sort of extra vulnerable right now, like especially youth, because youth and young adults have been a population that's really been struggling with depression and mental illness this generation. And now they're going through the loss of all those milestones like graduation or prom, struggling with distance learning, being stuck at home all day with their siblings and their parents and nobody can get out of the walls, all of that. Senior citizens who are isolated, people who already have pre-existing mental illness or substance use issues, they're all at extra risk right now. But the good news is that there are so many resources and they've pretty much all gone online. So the state of Connecticut, thanks Dave, has loosened up regulations so that mental health and substance use treatment, both one-on-one and in group, can be provided through teletherapy, which means by phone.
I think telemedicine and teletherapy is really one of the better things that going forward, I think we can continue to use when this is over.
Me too.
How many patients can a doctor see in this format? Bang, bang, bang. Ask that 5-minute question that you had, you know, instead of scheduling. And I think it's terrific. And I for therapy, and maybe this is a question, because I haven't asked a therapist. I mean, anecdotally, I think this is a great way to do counseling. Have you found that it is as effective as in person or a good substitute to do
so
sort of?
Definitely, it's for some people, they prefer it. We're literally hearing that some people prefer it. Some people would rather not be on camera, so they're doing phone service. It's probably a little harder if you've never been in therapy before and you're starting the relationship from scratch because it's a little off-putting. We actually made a video last week with a therapist and a client talking about that experience of, you know, I'm doing this virtually. But the positives, this is definitely a silver lining to COVID because therapists are seeing, you know, their no-show rate is reduced. People don't have to deal with transportation and childcare to get to an appointment. You know, all you got to do is find like your private space and join in. And so really I hope that going forward, those regulations will stay in place so that people have both options and they pick what works for them. It's also important to know that there are hotlines for any crisis 24/7. They speak different languages. They're free. What I'll do in a minute, Dave, if you can let me share my screen, I can pull up a image of some of the hotlines, like a flyer.
I would appreciate that. You do that whenever you like.
Oh, okay. Oh, I can share it. Okay, I'll do that now. So this is our poster listing some of the key hotlines. The top group of them are all in Connecticut and some of them are national. I just want to mention that Connecticut does have mobile psychiatric crisis 24/7. You call 211 and you're talking to a clinician for free and they will get to you if they need to. There's this new parent caregiver line called Talk It Out that was started by the state. It's not 24/7, but it's most of the time. And that's for when parents are feeling completely overwhelmed. And the crisis text line is this fantastic 24/7 national resource that youth and young adults in particular are more likely to use because they would rather text than call. These are just great options for people to know about.
Well, I appreciate you putting that up on the screen, and hopefully people can pause it and take down the numbers. But we'll also provide a link on the bottom, hopefully, when we do your website. I had intended on putting a link because it had so many resources. It was awesome.
That's great. And I'm actually showing like one more of our resources, but yeah, they're all downloadable there. Let me stop sharing that. So yeah, there are warm lines. I will say quickly what the difference is between a warm line and a hotline. A warm line is really, you're just calling and you're not talking to a trained clinician. You're talking to someone who's got that same experience you have. So there are warm lines for first responders, and there are warm lines for healthcare workers, and there are warm lines for seniors, and there are warm lines for young adults, and there are warm lines for people with mental illness. And that's so great. And then there are support groups, and it's also important for people with substance use challenges and family members who are like, how do I deal with my husband who I suddenly realize is maybe drinking a lot more than he used to during this time? All these groups, Smart Recovery, AA, NA, Refuge Recovery, all this stuff is online. And again, yeah, you can find all those lists on our website. I just want people to know it's all out there.
I think it's terrific. So if I could just ask you an opinion question, because this keeps coming up with our friends and neighbors who have children in the school system, is that I talked the other day with a child social worker about the stress on the kid, and then what do you do when your child gets overwhelmed or starts crying or has that meltdown because they're feeling overwhelmed or isolated or whatever? And when do you know, or when is the trigger or a sign that maybe you should ask for more help? It's not just your child having a meltdown and you console them and talk to them that, you know what, I think I need to reach out. Can you go over what that sign might look like and then who they should reach out to?
I think you have a combination of like, how's the kid reacting and how are you reacting? If the kid is, if you're even asking yourself that question, then I would say, well, you got nothing to lose. Make that call, right? So then maybe start with the new Talk It Out helpline that I mentioned, because then that's actually operated by the United Way of Connecticut and Department of Children and Families. So they'll help you go, is this my anxiety? How could I support my kid in a different way? Or should I actually get my kid some counseling? But, they'll walk you through that and they'll calm your anxiety around the issue and they'll advise you. If you're fairly clear that the kid is really in their own crisis and it's not just about you figuring out how to handle it, then I would say call mobile crisis. It's literally dialing 211 and picking option 1. And then again, you'll talk to someone who's a crisis person trained to work with young people, 0 to 18. And they can, again, talk to you, come to the house, get you an appointment at one of the state's child guidance centers, which is a system statewide. And child guidance is great because their whole specialty area is counseling for kids, counseling for parents. In normal times, they do like after school groups. It can be everything from emotional challenges to anger management, behavioral outbursts, all that stuff, depression. So yeah, I basically, if someone's out of control or just feeling like this is too much, just make that call. The calls are free. So they'll help you.
I mean, we get so many parents that talk about that their child just feels overwhelmed by the situation. Either they feel they have more schoolwork than they did if they were attending school, or we were talking the other day that we really haven't gotten this scheduling thing down right. Some parents are doing it great and some aren't. The kids are sleeping most of the day. Everything just seems to be off. And we asked Peter Tolk the other day if he had any tips or tricks about scheduling. And I didn't know if you wanted to expand on that or if you had your own point of view. We'd be happy to hear it.
I mean, I think the other piece of this is everybody needs permission to feel the way they're feeling. And as parents, oftentimes we want to fix things and we can't fix a lot of these things. So a lot of it's learning to talk to your kids and being really prepared to listen to what they're feeling and giving them permission to feel what they're feeling, because everybody's dealing with their own wherever they are. at this place. So I think part of it is also just trying to give kids the opportunity to tell us what they're struggling with, and being prepared to kind of hear what they're saying. Some kids are handling this just great. And so you don't want to be like, well, why aren't you, I've got some, personally, we all have our own kids, and we see that they're all dealing with these things differently. So I think there's also an opportunity to look at some of the family therapy options too, where you get a chance to have like a professional help you kind of figure out how to communicate together as a family. Margaret, do you want to jump in? Or
I just want to add, you need to let them feel how they're feeling. And I think a lot of us as parents feel like we have to have the answers, but and to the point where we're not saying, I feel the same way. So we have this opportunity for like a genuine emotional connection with our kids, where we go, I feel the same way. Like, I think all of us have, like, at first or at some period in the last couple of months, we've gone through like, what's important about my work right now? What should I be doing? What should I focus on? Like, we can say that, like, I'm in the same boat as you. And I think that helps with everyone. And I think one of the things that we were talking about in a different conversation yesterday is we, as parents, if we're adding to the anxiety and the stress around school, because we also are like, what about your grades and what college are you going to get into? We can back off with that a little bit now, and we can say, I'm here as your parent and your supporter, and let's work on the quality of our own relationship and our family dynamic. And the academics, that's something you're going to deal with school, and it's going to be what it is. And
basically don't pile on.
Yeah.
Don't pile on.
Well, I think there's a point where every kid in this world is in the same boat, right? I mean, there's worldwide disruption to normal. So getting ourselves worked up as a parents about what the future holds for our child isn't really productive right now. I think it's kind of building on what Margaret's saying. As a parent of teenagers, I totally get this. You're worrying about, what does this mean for the normal college admissions process, the normal college process, the normal high school process. We don't know what normal is going to look like now, so getting ourselves worked up isn't helping our kids either.
And we had also talked the other day about how much you share with your children. I mean, there are probably work pressures or family finance pressures, and you know what? I don't know the answer, but do you leave them oblivious, or do you include them with a little bit? Do you not burden them with it? I mean, how do you handle some of that? Sometimes I think as parents, maybe we don't realize how much we're bringing home. So I didn't know if you had any tips or tricks.
We don't even have to bring it home. It's already here. It's not even like, it's, a lot of us are working from home. So these stresses are in our houses. I think it depends on the age of the child. I think it depends on the anxiety level of the child. I think if you're looking at, needing to cut costs within your, cut expenses within your own family, you can involve your children in that discussion. Because I think it's almost worse for kids to be kind of sideswiped by these things as well. So personally, we're having conversations. What's essential? What's not essential? What are we going to be cutting back on? Summer vacation this summer is virtually unlikely, right? Because of financial issues, travel issues, whatever. My kids are teenagers, so I can talk to them and they understand it. And for younger kids or kids who are very high anxiety or very worried about change or disruption, that might be a conversation you want to go a little more gently into.
Yeah, I think younger kids, whatever it is that you think you've told them or whatever you think they may have heard, I think it's important to get them to feed it back to you so you can be sure what they've heard from it. Because I know even early on when parents were trying to, there's this message to some of the young kids, like, don't go outside because there are these these enemies in the air that you can't see. That's a scary message, right? And we were hearing about little kids who are afraid, now my mom's going to die, my dad's going to die. So you definitely have to filter how much information and then let them tell you what they understood so you can know what they're afraid of and then handle that.
Right.
And you're saying most of that's parent driven, but that sort of therapy or that's sort of how you handle it is parent driven. And then would the parent have one of those numbers that you put up? Would that be a resource for them to maybe come up with a better strategy for dealing with the kid? Because you're right about that invisible enemy thing. You can't see the corona. I mean, they might be afraid to go outside or fearful that their parents are going to catch it.
Yeah. And they could absolutely call that parent line. And I think we have links on our website. There was a lot of, I think there were a lot of things that the schools sent home in the beginning when kids were still in school, and you know, saying how to talk to your kid by age. It's not too late to go back and review that guidance, and it's not too late to call any of the warm lines.
I didn't know if you wanted to. Yeah, I thought you were chiming in, Melissa. And
I was thinking about it. Margaret does such a good job of summing it all up. I do think, you know, the fear, you know, I worry a lot about how kids are going to think, you know, those kids who already didn't feel hugely connected to school. And now they've been away they'll be away for 5 months. I worry about, you know, going to the grocery store is a stressful endeavor right now. So a lot of the things that were normal are now going to be a little more stress inducing for everybody. So part of me is thinking, you know, okay, we are going to have to keep talking to our kids and working with our kids and getting supports when we need it, because this is what we're dealing with. And
one of the questions that came up last week with Peter was, how do you deal with a child's anxiety? Because you're right, they are going to be disconnected from the school for 5 or 6 months. Just the fact that they have to start up again might just sort of be an overwhelming or insurmountable stress. I didn't know if you had any tips on how to deal with that.
Well, and I think the schools, to Margaret's point, like the schools are gonna lead us as well, and they're gonna be a big part of this conversation. So it's working aligned with what the schools are telling our kids and what we're telling our kids. But I do think if you're keeping the communication kind of open along the way, it becomes a lot easier over time, right? It's really hard to dive in month 5 and try to figure out how to help your child navigate, right?
So Margaret, as I have you, I'm going to give you one of the questions that we've sort of been going over and over. Is my son says the Xbox is the only way he gets to talk or interact with any of his friends. However, it does seem to be a never-ending game time. Do you believe this type of interaction is harmful? And if so, how can a parent effectively limit it without a huge fight?
Oh, Dave. I live this battle just like all of us. Right, we all know there's the positives and there's the negatives to screens. I think right now it's definitely probably tipping toward the negative for a lot of kids where that's the only thing they're doing. I think what helps is that we can go outside, and I think we do have to set limits and go, you got to spend a certain amount of time outside, and you got to spend a certain amount of time like in social relationships that, you know, so if, okay, you got to do it by screen, what game can you play online with your friends? What other things can you do? And when you say like, can you do it without a fight? I mean, that's the whole thing about setting boundaries and being firm about them. And that is the trick of being a parent. I'm not good at that. I think most of us struggle with that. I've got one kid who's online all the time and one who isn't. And we're all like that, right? And it's, you know, one option is to get in there with them and try to do it with them and see what they're getting out of it and talk about it. But part of it is you got to say, let's be well-rounded. Let's do a little body, mind, soul kind of thing and not spend all our time on the screen.
And if I can jump in, one of the things we always talk about at TPAUD is like, you don't have to fight these battles alone when your kids are doing social activities. Like we encourage parents to like work together because the kids work together, like they're scheming. And so, you know, parents should scheme together. So it might help to reach out. If you know there are certain kids that your child's playing with all the time, reach out to those parents and say, you know, hey, can we set a curfew for all our kids? So at least then you don't have the kid who has to get off when nobody else has to get off. So
an alternative. You go, we're all getting off because we're all as a family going to have family game night.
Yeah, that's really smart, Melissa. That was really good tip. I'm going to take that tip personally. But the other one was Peter Tolk had said the other day, which I hadn't even considered, is just make sure, you know, it might be their only friend time, but make sure it's friends they have like in real life. It's not virtual friends that they've never seen or met. But if it's, you know, Johnny or Billy from down the street that they go to school with, then it's okay. Like it makes it the time on Xbox or virtually better. I didn't know if you agreed with that or what your thoughts were on that one.
I think there's go ahead, Melissa.
No, I was just going to say, I agree with, I mean, I'm watching it my own children that they're playing with their school friends and it is their way of interacting and staying connected to their school friends. So I do see the value, but back to the balance of, you know, especially now that the weather's getting a little bit nicer, that we should be encouraging our kids to be whole-bodied.
Get outside, right? Keep the schedule, get outside. Yeah, I can see that.
And It is like, you know, the somehow the way you said it, Dave, helped, I think, identify that what parents really have to do is just try to like get a sense of what is this doing for your kid and what does it mean to them. So it is about the balance and how much time, but it's also, you know, if you know who they're talking to and you know what they're doing, and it might be that your kid doesn't have any friends at school and their only friends are online. So in that case, you also don't want to cut them off from that. But just, you know, everyone needs some real life friends too.
One more. I promised that we wouldn't do this too long because it can get long, but you guys are such an unbelievable wealth of information that some parents have expressed frustrations that their child just doesn't care. Or when we asked for questions, this was this one in the Xbox, let's be honest, came up the most. Like, I can't get my kid to do anything. They just don't care. They don't care about the consequences. They don't. So they're sort of different to the instruction, I guess, is the question they were asking.
That's a hard one, frankly, because honestly, the learning, if you're talking about kind of not caring about school and the results, or are you talking about?
No, yeah, because there's no
like chores. Are you talking about?
I guess there was no immediate consequence. We don't get sent to the office. We don't get a bad grade immediately. In fact, the teacher could only call or email my parent. There's no sort of, hey, you didn't do your homework. Yeah. And so the kid sort of, I guess some children have been just sort of, hey, I'm indifferent. I don't care. I don't care if I fail. I don't care. It's just odd, but the question was there, so I figured I'd ask it. Okay, Margaret, you're up.
You know, I thought
I had
the answer. I would have answered it.
I mean, I think, you know, if it's about schoolwork and they, you know, were already kind of a kid who hated school or was disaffected, maybe this is a continuation. But I also wonder, you know, is that a sign of some kind of depression? I mean, I think it's worth, I think you have to reach out and talk to the teachers and maybe this, I don't know, I don't live in Trumbull, I live in Norwalk, but the school's social work department is literally available to parents online certain hours. Like they have open office hours for parents and or kids to call in every day. I think that's worth really assessing because is it a question of you or the school finding the appropriate carrot or stick or both to get your kid to do the work, or is your kid really struggling and this is the way they're showing it is that they are shutting down, and that's a real concern. I mean, this is
a very good
tough time for kids.
I was going to say the other thing is that we've got to accept that not every child is going to learn well through this platform of the way we're delivering instruction right now. It's very difficult for a lot of kids for a lot of different reasons. So I would also encourage parents to reach out to their child's teacher or counselor. You know, if they're at the high school, their counselor, or at the middle school, their school counselor, because I think they are working hard to engage all the kids that they, you know, that may not be as engaging as well as we want them to. So I would also try to understand what's available to them to help them, but also to understand, you have to understand your child as well. Some kids were really disengaged with school to begin with. So this is kind of understandable. If it's a dramatic change in your child's engagement, you know, they were really into school and now they're not, then would certainly spark a real concern to use some of these resources that we're giving parents today.
Yeah.
So, Margaret, I know that this conversation we're having is going to generate many more questions. So I'm going to put you on the spot and hope that maybe we could do this again when I get another email full of them. You have been great. This is smart. And your website is unbelievable. And I'm hopefully at this point, it's at the bottom of our video and everybody can go to it. But I would be remiss if I didn't give Melissa and TPAUD a moment to talk to parents about the dangers of not putting things away in their house, especially when everybody's home all the time.
Thank you. One of the things we really do encourage parents is to help us reduce access to alcohol, drugs, prescription drugs, alcohol, marijuana, if you have medical marijuana, any substances that you might have in your home. We're all at home, and in some cases, people may have more alcohol than they usually do in the house. They may have prescription drugs. Right now, we know that it's hard to get to, you can't get to our drop box to dispose of prescription drugs. So you can go on our website, tpaud.org, tpaud.org, and we have instructions on how to dispose of prescription drugs in a way that's safe for our environment. So we encourage people to do that. You can also reach out to us at tpod@trumbullps.org, and you can ask for a drug disposal bag, and we will put it in your mailbox if you would like one of those. It's really important you lock up your liquor, lock up your meds. Social access, getting these substances from family members or friends is our #1 source for kids in Trumbull. We know that from our surveys. So you do have the power to kind of cut that down. And vapes as well. You know, we know that vaping was a significant issue, and we know the state passed some good laws to cut access. But if you feel that your children are exhibiting some signs that maybe they're going through withdrawal or having some issues because they can't get access to devices they used to be able to get access to, please reach out to us or the Hub, and we can connect you with some resources for that as well.
If I've learned anything, I've learned that we are the gatekeeper, and it's our responsibility to keep this stuff away from the kids. And the longer we do that, the longer they go without trying it or taking anything, the better off they're going to be, and the less they are to be addicted. So I've learned a lot through TPAUD through the years, and I appreciate it. And I really appreciate both of you coming on and helping out and answering questions. And I guarantee you we're going to have a bunch more.
Perfect. Thank you. Thanks for having us.
Thank you.